What's happening in 2011, University of Missouri has a couple of staff doctors that are working on some human studies for the human effects or the side effects of these compounds. Some behavioral analysis is being done as well as controlled studies. It's very difficult to get people to volunteer to be a part of these studies because the compounds are pretty dangerous. The reason that, and their research should be out by the end of this year to give you some more definitions in terms of, what levels are considered dangerous, a single use, as we heard Ron mentioned about his own son, a single use was pretty devastating. Others have used the substances over and over again and may have mild side effects. The concern about these compounds is they're synthesized, they're chemically produced, and they result in a lock and key scenario, and they affect the same neuroreceptors as marijuana does in the brain, except that it's a perfect match. And with that, and you can talk to I think there's some people from the healthcare profession here today, that addiction is very quick when you have those perfect relationships in the scientific brain receptors. Aside from marijuana, if you look at marijuana is a plant. You're going to have some natural effects from that, but it's not synthesized to be a perfect lock and key scenario. So where many of the plant type materials like marijuana and some other things may give a certain effect, what we're talking about is a synthesized chemical compound. And as I mentioned, most of these compounds are produced in laboratories, whether it's here locally in the United States or from abroad. We're not exactly sure where all of the product of these materials are coming from, but they are being marketed over the internet. And you can buy the base chemicals and produce these drugs and package them fairly easily. So barrier to entry into the market has not been shut down. So until these bans go into effect both at local, state, and federal level, you will have the situation where they're hard to enforce and shut down the distribution models and manufacturing models. We just recently got an update, and it's part of the handout from the American Poison Control regarding the number of calls that they receive. I think in 2010 they received somewhere 2,882 calls to their hotlines regarding the synthetic cannabinoids. So the calls and the concerns over people finding their children, finding people under the influence of these compounds is on the increase. As of February, there was already 706 calls recorded related to these compounds, and as many as 8 known or suspected deaths in Texas alone. We've been involved in a couple of cases of postmortem toxicology with some cases out of Dallas, and it's pretty devastating to see the effects of these compounds on individuals where they may not be a routine user, they may have been a single user or gotten a bad batch of chemicals since they're synthesized in a laboratory, and there's no QC on this product. It's sold as an herbal incense, so it kind of skates around the FDA review and quality control scenarios. So if someone can spray it in a bathtub in a hotel room and sell it as a compound, what do you think is, this batch may have a high level and the next batch may have very little, but it's still sold all the same. Some of the signs and symptoms of these compounds are profuse sweating, irritation, heart palpitation, changes in body temperature, insomnia, erratic behavior, denial is one of the other main side effects, and violent vomiting. That you're ingesting a very toxic chemical, and the effects on the brain long term. Once you have ingested these compounds from a toxicology standpoint, you have now changed the brain activities, and many people have long-term effects from the use of these chemicals. One of the things I would like to share with you, some of the stories that we've heard from some of the chemical plants and some of the industry workers, is people would be bringing these compounds into their facilities, packing them inside a cigarette or the Swisser sweets or whatever, the little cigars, and go to the smoke areas and be smoking those on the chemical property or the plant property, and thinking nothing of it, throwing away the packages, whatever, because they're legal. They went down to the local Stop and Go, Valero, or convenience store and bought that product. It's not illegal. They can buy it over the counter, so why shouldn't they be able to utilize that product? Well, it does change behavior, and these people are under the influence of the very toxic substance. What we're seeing is this is on the rise not only in the high schools, it's present in our communities, it's readily available, and it's infiltrating the workforce. Why? Because right now most of the substance abuse panels and processes or programs that are in place do not test for these chemicals. It's not to say that you can't test for them, they're just not on the panels yet. What can you test for? Right now there's two matrices that are currently available. Blood, where we see a lot of that in the postmortem toxicology, or from the emergency rooms. We are getting calls from our emergency room hospitals in the medical center where people are coming in the ER and demonstrating a lot of these side effects and signs and symptoms, and they're taking samples right then, and we're testing these in our laboratory and helping them determine what these people are under the influence of. Also, urine is a known detection. The detection windows are pretty short. They'd be similar to cocaine in terms of 0 to 48 hours, which is a standard detection window for cocaine. Saliva, right now, we're looking at methods to test in saliva and also in hair to determine if we can pick up these compounds and that they're still in the research phase. What is the risk? The risk of use is increasing versus the cost. Why? Because it's not detected in most drug tests. It's readily available and it's inexpensive. Okay? What is the risk to you in the workplace, to your family, to your those people in the schools? It's also on the rise, because as these compounds become more readily available, the risk is out there of injury in the workplace, and also damage to property, and also the potential of loss of life and long-term damaging effects to some loved ones. When is it practical to test for these compounds? For cause, for suspicion in the industrial or workplace scenario, post-incident, post-accident, because then you can, because the short detection windows, you can pick those up. You can test for the common band DEA panels or some of the other analogs. Any questions?
Is the legislation in the different states, are they banning the use, the sale, the distribution, or just what exactly?
They're banning, different states are banning different things. I sent a handout shows each state by state what they're banning, and generally they will ban the use and manufacture and distribution.
Okay.
But each state is listed on there in terms of where they're at in that legislative process. Some states have been very proactive. Missouri was one of the first ones to get involved, and other states. But you know, they've really got a federal ban now, and now the states have got to kind of enact their own legislation to support them.
Okay. Good. If y'all didn't pick up some of the handouts outside, be sure you get some on your way out.